Welcome back, dear viewers, to the studios of Health-Kuwait as we continue our program for this evening and continuing our coverage on the COVID-19. For that, we have with us Dr. Mohammad Alkhamis, an assistant professor of epidemiology and biostatistics at the Faculty of Public Health here in Kuwait University. Dr. Mohammad, welcome to the studios.
Thank you for having me.
And thank you for joining us. Of course, Doctor, we are facing a global pandemic, and here in Kuwait as well, we're being challenged to control the virus. So tell us from your experience and from your knowledge, what is the current situation like here in Kuwait?
So first of all, I would like to say that we are so lucky to be in this country, because if anyone of the citizens look at the situation around us, surrounding countries, particularly heavily affected countries. I mean, we are so lucky that we are so many small number of cases. And this is attributed to the Ministry of Health. They are working day and night. Like, they literally abandoned their normal life, including the minister, just to make sure that this number of cases are down. Now, what really saddens me is that when I see citizens in Kuwait or like people staying here who are not adhering to the instruction of the ministry, they think that this is some sort of like something will come and go, or like something like seems like to be a game. Like, to me, it's so sad when people, they don't take the direction of different government also agencies about the seriousness about staying at home, about social distancing, about curfew, because actually what made us so far succeed in this is because of these kind of implementation. Exactly.
These regulations are put in place to protect us.
And again, like, I am also, I urge everyone, please adhere to these things so that we can continue this successful, control or, or kind of prevention in terms of COVID-19 situation in Kuwait.
Right, Doctor, especially as a curfew has been put in place going into effect today, the 22nd of March, from 5 p.m. until 4 a.m. Now, Doctor, we're taking these different routes to, in a way, control the spread of the virus. But on a global level, there are different scientific views that are, some are more optimistic, some are more pessimistic. So tell us about the difference of both.
So some people say this will cause more devastating death, even with countries with in which they finished from their first strike, like in China, or something, that there may be another strike. Some people say that this will start to target other high risk, because as you know, COVID-19, and the reason, by the way, we are having these measures is that because COVID-19 targets the elderly that have immunity issues.
There are groups that are more vulnerable to the virus.
And now there are also saying that this virus might also affect other categories such as diabetic or obese. There is not enough evidence about it yet.
Okay.
The other optimistic view is that maybe temperature or weather will soften, or maybe take down this kind of spike of cases worldwide.
Okay.
Because there is some evidence that the virus does not really survive
in higher temperatures.
So that might help. However, on the other side, saying that it might end up being seasonal, in which it will go down this summer, but then when there is a fall, it will start to another spike. Now, and this is basically it. And see, this is the optimistic, that hopefully the heat will end up taking this epidemic down. Now the question is whether it's going to die out or not. We don't know. The good news here also that there is vaccines and medicine coming.
Being worked on.
Yeah, exactly. Yeah, and actually, and people like also in this term, comparing it to the flu, yes, there are more deaths from the seasonal flu worldwide. The reason that we are worried, the reason that we need to be in the middle, looking at different time, and we have to be ready. So we cannot be very pessimistic. We cannot be very optimistic about it. We have to be so far in the middle, because we still lack a lot of data in terms of the virus itself. We still don't have any idea about whether the vaccine will be available soon.
So these are some of the pessimistic views.
Exactly.
That it won't get better, it will actually get worse.
There is also, it gets worse, better. And then the thing is that we are also in the process of developing herd immunity. Basically, as we are getting exposed or recovered even without showing clinical sign, with time, we're going to start there will be changes in the virus population dynamics within, in terms of spread, and also us, by implementing these kind of measures, also would change our own dynamics. So there is an interaction there. Now,
Doctor, you mentioned the herd community though. Tell us more about that, and you explained that the interaction between humans with each other plays a role in the spread of the virus. Please clarify.
Yes, so herd immunity is a very important component.
Herd immunity.
Yes, herd immunity, sorry, yeah. Herd immunity is a very important component in understanding the disease dynamics. So basically, if I got infected and then I recovered, I developed some kind of antibodies, okay? And think of me as an individual within a herd in which I become in contact with people. I either infect them, they get infected, and then they recover.
Right.
And then, it's a collective thing. Okay, so that's why it's called herd immunity.
Right.
So as we get infected and recovered, our body, and then again, sometimes we get reinfected, so the body start to build antibodies against the virus.
Right.
So imagine this on the level of the society. So you will see that most of the society have developed some partial immunity by having antibodies that is against that virus. So that over time could also potentially decrease the amount of transmission of this new, because this is a completely new virus in which our body still does not really know how to react to it, although there is no mortalities in many groups, only in a specific group.
Okay.
But still our interaction, our dynamics together could help either make it better or make it maybe, depending on the mutation, depending on the weather condition, depending on many factors, not just, by the way, human conditions. So there is plenty of components that also, by the way, like the weather itself also affects our immunity and immune development. So it's a very interconnected concept.
Well, doctor, this is a perfect point, because it brings us to the next question as to how we are interconnected. As you said, we are in this ecosystem where we depend on the environment, we depend on the animals that surround us. So tell us about the concept of One Health that embodies this interaction and how it can play out with the COVID-19.
Yeah, so that's a very important, because One Health is a holistic kind of vision. And us now, epidemiologists, are leaning to it, because see now, COVID-19 started originally based on the evidence from science that it's from basically a mixture of a coronavirus that infects snakes and bats. And there have been a lot of exchange in which the virus is jumping between those two animals.
This is for the current strain of COVID-19.
COVID-19, yeah. And then you have China. China is, Wuhan is an expanding country, because they go and inhabit the natural habitat of those animals, and also they hunt them and consume them also in live animal markets. And by the way, live animal markets are very important source for emerging pathogens. So like avian influenza, swine flu, most of those viruses emerged from live animal markets. So basically you can see that there is an origin of animals, and then there are weather conditions.
Right.
There is demographics that surrounded this virus. So this is the environment. And then we have the humans who got infected. So One Health says animals, environmental, and human health are interconnected. When you want to look and solve the problem of COVID-19, you should go to the origin. And then we are now in the middle, and there is the end.
Well, clarify that.
Yeah, so the origin is animals. Okay? Animals and environmental interaction. And now it got into us as a health, okay? And now remember when we talked about the weather. We are now waiting for the weather condition to change.
Hopefully, yes.
Hopefully to change the transmission of that disease. And then the question is, will people again consume unusual animals like snakes and bats, and then there is a re-emergence. So basically we need to see the origin.
Right.
We need to continue monitoring the origin of the virus. We need to see how the environment interacts with the virus itself, and then also we want to study the interaction of virus dynamics within the population of humans.
Right.
So you can see it's a chain, and also it's a triangle at the same time. So you can look at a different direction, but in the end, you cannot, when you want to solve a problem like this, you cannot discard those components.
Right.
That's the whole idea of One Health.
And it's a continued effort, doctor, that's happened on a global scale. So tell us, for example, from your perspective, what is the one key advice that people should abide by in these hard times to help control the outbreak?
So first of all, adhere to the any directions or any laws coming. You have to adhere to them. Let's help the government. They are trying their hard to prevent this from spreading. So this is very important. The other part is that stay away from fake news and social media that are not related to that subject. So you need to listen to people who are in the specialization itself, like epidemiologists, virologists, and also look for the right sources, like the Ministry of Health. They have a very well-made website. There is the international organization, World Health Organization, that are actually posting those things. So this is where you find your actual information. So that's basically the main advice that I would give our citizens here.
Thank you so much, Doctor, for joining us and for all this encompassing look at the COVID-19.
Absolutely, my pleasure. Thank you for having me.
So, dear viewers, with that, we have come to the end of our discussion with Dr. Mohammad Alkhamis, an assistant professor of epidemiology and biostatistics at the Faculty of Public Health here in Kuwait University. And to wrap up tonight's episode, it's the most important point for you to adhere to what is said by the ministry and the public officials, in specific for the curfew that has been put in place starting today, the 22nd of March. Please stay in your homes between 5 p.m. and 4 a.m. This is done for our safety. Until we see you again next time, stay calm and stay safe. Bye-bye.